can hear my heart beating amid the people and the frenzy around me, and my questions are left unanswered because they are seldom heard. I am alone.
Modern technology can mesmerize you. Fabulous facilities can hold you in awe. Doctors' expertise can overwhelm you. If you don't have a clue where you are not just alone, you are lost.
We lose ourselves in our search for clarity. We want to know, and we want the best. Above all else, we want the power to decide for ourselves on things that secure our health and impact our lives.
We need a friend that we respect. We need a partner that we can trust, who respects and trusts us just as much and keeps us company as we find our way. The Medical City Cardiovascular Center.
The cardiology section was formally organized in sometime in the late 70s, maybe around 1977. At the beginning, the practice of cardiology is purely clinical evaluation because at the beginning we don't have the sophisticated gadgets. We have only the electrocardiogram, two-step test, and maybe we are just starting treadmill exercise. So we depend a lot on clinical history and physical examination to make a definite decision. Right now, it's a big contrast because at the present time, I would describe the section of cardiology under the Department of Medicine as a world-class section with practically all the necessary gadgets and equipment that is needed to diagnose, manage, and the definitive treatment of heart disease at the Medical City and also in the Philippines.
State-of-the-art cardiovascular facilities that ensure patient comfort and safety, and a memorable experience.
Medical City has a strong open heart program. We started doing open heart surgery a few years back in the old Medical City. As we transferred here in the new hospital, we are very lucky to have new and top-of-the-line operating room equipment. Our recovery room and intensive care unit have complete facilities for our post-open heart patients.
For a young open heart program, the Medical City surgical program has very good results, and our mortality rate for elective open heart surgery is down to about 3 to 4%, and this is comparable to world standards.
The Medical City ICU includes our coronary and cardiac care units as well as our telemetry. Each ICU bed is equipped with a top-of-the-line monitoring system which is multi-parameter and all fed into a centralized station which is monitored by dedicated monitoring personnel.
The Medical City is one of the best cardiovascular centers for pediatric patients with heart disease in the country today. We are equipped with state-of-the-art cardiac cath lab where we can do both diagnostic and therapeutic interventions. The open heart facilities also are suited for doing even complex congenital heart surgeries. Our pediatric ICU and other diagnostic facilities provide support in the total care of pediatric cardiac patients.
The training program in the Medical City Adult Fellowship training is very comprehensive. Our fellows rotate to different areas in the hospital, specifically in the wards where they look into or take care of our cardiac patients. They also go to the ICU to take care of our critical care patients. And they also assist as far as interventional procedures concerned in our cath lab and surgical suites. The fellows also do research, clinical research, which is actually part of the requirement for graduation.
Appropriate use of modern technology for the benefit of the patient, first and foremost.
We are proud of the fact that our group, while small, is composed of dedicated interventional cardiologists who have the proper training, they have the proper skills and the proper credentials. So that is an absolute. We're also proud of the fact that we do things based on evidence. You know, anybody can open up an artery on any patient with a few months of training. But we do this based on evidence. We do this based on a teamwork with the patient. You know, we give them options, we give them choices. So we work with patients, and that's one thing I'm proud of. It's not like we do blindly open up arteries just like that because there are arteries to be opened. We decide whether the patient needs it. We decide with the patient what's the best option for this. So each patient is treated individually.
At the Medical City, our vascular team includes both medical, surgical, and interventional specialties, which all work together for the betterment of our patients.
Our cardiac rehabilitation has a personal touch. Although we do have collective activities such as calisthenics and exercises for the patients, we have personal one-on-one supervision. We make sure that the patients are aware of their risk factors for heart disease and the goals on how to tackle and avoid them with short and long-term goals. Cardiac rehabilitation is not really a lucrative profession, but is service-oriented and is really a relationship with the patient, the goal of which to bring him back to his optimal well-being is common goal between the patient and the staff.
Informed and empowered patients who play an active role in the management of their health.
I liked the way that he was handling me, and he suggested to go through the procedure. He asked if I want to do it in the hospital. I said yes. The hospital is new. I found the hospital absolutely marvelous. The treatment was excellent. Dr. Martinez is a fantastic doctor, a wonderful man. The procedure was practically painless. Highly professional by the entire staff. The rooms are very nice, very clean. Staff is extremely friendly.
This is the first time in my life I've been hospitalized ever since I was born. That's why I don't really have any comparison, but during my angiogram with possible angioplasty, Dr. To and the nurses and Dr. Nasal, they were really, shall we say, I don't want to call it accommodating, but reassuring, because definitely that part of my life, I was really depressed, and you have to have someone who had the medical expertise and the emotional guidance to pull you through, because I was really nervous.
At first, I was hesitant to undergo, but with consultation with other doctors, here also talking with them, asking what would be the consequences, what would happen after.
Na-explain nilang maigi at yun talaga ang dapat gawin. So, yun ang pagdesisyonan ng wife ko, ng mga kapatid ko.
A compassionate staff with a zest for life. real partnership between equals.
The name alone, Medical City, does not imply it is a hospital. They helped me whatever would relieve me of my difficulties. They were always around. I don't know if that is a special treatment. It's just that whenever I would request for some assistance or whatever, they were always around.
The physical facilities are really secondary in nature. It is how they treat you. The staff in the male assistants and all that were very nice. Yeah. You have nothing to worry about. They're all paying attention. So when I was brought into the rehab, there was something I noticed with the rehab. There was the doctors and the staff had a lot of dedication and care and concern.
Sa doktor, wala akong masasabi. Mababait. Saka sa mga nurse, siyempre, papasalamat din ako. Ganun sila ka-open.
Ang sinasabi ko talaga dito, sabi ko, parang hindi ka nasa ospital. Yung pag-aalaga ng mga doktor, nurse, na hindi ko naman nakita sa iba. Siguro kaya maaga ako lumabas eh.
I think it's a key word when you're sick, you want to feel that you have personal attention. And I got it from all the people, from the nurses to the people who accept blood or give you the pills or whatever is necessary.
There are cardiovascular centers and there are cardiovascular centers. We are very, very proud of the Medical City Cardiovascular Center. Certainly, it has one of the best facilities in the Philippines, if not in the world, where patients can really look forward to a healing place where they can be comfortable and secure. Certainly, the center offers state-of-the-art technology, just like any other center. Certainly, it has experts who are well steeped in evidence-based medicine. But what animates the Cardiovascular Center of the Medical City is what happens between the doctor and the patient. The passion for compassion, the culture of warmth and empathy, and the total experience that the patient can really feel, as well as the doctor can really feel, when doctor and patient are together in a partnership. We are certainly going to be distinct, and we are going to set ourselves apart because we are going to focus on the appropriate use of technology. In the Medical City Cardiovascular Center, we put a premium on patient empowerment, where patients can actually be involved in the decision-making process on anything and everything that involves his health. We are going to be in the forefront of cardiovascular research, from stem cell and molecular cardiology to clinical outcomes. And from these outcomes, we envision ourselves to be a leader in cardiovascular medicine and surgery in the region and in the Philippines as well. So we actually look forward to people realizing that while there are certainly so many cardiovascular centers, the Medical City Cardiovascular Center is a place where you can actually be in the center of it all.